kind of what we are after. It was brilliantly captured by Vinod Khosla last evening. So what I'll do is I'll just focus on two specific areas which are our current areas of activity. And I'll start with the caveat that all of us who are involved in this, and I'll mostly be presenting results, preliminary results from my colleagues. We are primarily computer scientists. We don't have any real knowledge of the healthcare domain, but we are establishing partnerships with the medical professionals and trying to combine these two domain expertise that we respectively bring to hopefully come up with some breakthroughs. So the first area that I'll talk about is non-contact video-based detection of body vitals and diseases. And this has been led by our colleague Lalit Mehta, who's a Xerox fellow. And this has been a wonderful collaboration with Manipal Hospital. And we are looking for more such collaborations, in particular with Apollo. We'll welcome further collaboration. So before I talk about kind of how do you do analytics using video, I mean, you might wonder, so what can you do with simple video? I mean, if I'm only capturing, let's say, the images and so on from a standard video camera, what can you do? It turns out that depending on the wavelength of the lights that you're using, you can have very different levels of penetration. So with a blue light, you may be able to look up to the top layer, back to the biology lessons. This part I still remember a little bit from my biology lessons, the epidermis. But as you get to longer length wavelights, red light and so on, you can start to peer inside the dermis region, which is more full of vessels. And as you start to get infrared, you are able to look even deeper inside, including emissions from the body. So the set of things that we are after in this current study are, one is start with the vitals, the basic vitals, because I mean, when you go to a doctor, the first thing that the doctor or the medical staff does is measure certain basic body vitals, which give the doctor important clues about what's going on with you. And then after that, we are looking at, are there certain diseases that we are able to diagnose based on analysis of these vitals. And then there are some other auxiliary things that you can capture. So this one shows how do you measure the respiration rate and temperature simply by using a video camera. And essentially what we have done, it's, I don't know if this video will play here. I think there's some issue here. So this is, we deployed these simple video cameras in a neonatal unit of the hospital, in Manipal Hospital. So normally, babies have to be kind of in that unit, you have to have various kinds of sensors that are attached to their body and so on. And at least as parent, I mean, I find it very disconcerting for those babies to be having all of those sensors and so on. So now you have this camera which is monitoring. And interesting thing which is being done is you are monitoring the area very close to the nostril of the baby. And the very simple insight is that when you have the baby breathing, or anybody breathing for that matter, you have air which is coming in from, which is entering, which is at outside air temperature. And then when you have you exhale, you have air coming out which is close to the body temperature. So what we are, unfortunately the video is not showing up, but what we are capturing through those signals is those varying temperatures. And then through that, we are extracting the respiration signal, because as you capture the periodic interval of this temperature, which is varying between the body temperature and the outside air temperature and so on, you are able to infer also the respiration rate, and you're, of course, inferring the body temperature. Now, taking this one step further, we also, again, this was led by Lalit. They did this measurements where you are both doing the ECG measurements as well as through the simple camera which is inserted on top, you are also doing basic video camera measurements. And in the future, you can think of many of these technologies as potentially being available through your smartphone, which has all of these video cameras and so on. So here, we have these two sets of measurements. The blue measurements are coming from ECG, which is the gold standard, and the red set of measurements are coming from the video camera. And what these results show for different patients as this data was collected and analyzed is that while, of course, I mean, through ECG, you are able to detect these irregular intervals between those R waves and kind of infer the issues related to cardiac arrhythmia and this atrial fibrillation. Don't ask me about these medical terms. I'm just learning about them. Not only are you able to capture those through the ECG, even when you do analysis of the video signals, you're able to infer those irregular intervals. And again, with patients who are normal, where these intervals are relatively uniform, you're again able to infer that from the video analysis as well. So that's one. Now, moving on further, as we look at potentially some cases of diagnosing cancer. So we looked at the breast cancer diagnosis in this case. So it normally starts with you're looking at mammogram images which show, let's say, a certain tumor. So this is for a male patient. Now again, it is the medical experts who told us that when there is malignant tumor, there is also a lot of blood vessel activity in that region of the tumor. So looking at then the thermal image, what we see is that hotspot of activity showing up in the thermal image. And again, based on applying our computer science techniques of capturing these hotspots and so on, we are now doing predictions. And in this case, again, the system predicted that looks like a malignant tumor, and then in the actual clinical work, that was confirmed that it was indeed a malignant tumor. And likewise, this is for a female patient where again the mammogram image shows this tumor, this particular tumor, but the thermal image doesn't show any of that hotspot activity. And indeed, further clinical kind of work showed that yes, it was a benign tumor. And again, for the other patient where there was, again, the thermal image was showing that activity, it was confirmed that it was indeed a malignant tumor. So these are all very early results right now. I mean, they're not at a stage where we can talk about, yes, we have conclusively established. We haven't even begun clinical studies, but we are very encouraged. And again, trying to go after a bigger and bigger set of diseases that can be automatically diagnosed. So next, again, I'll give a peek at some work that we have just started on a decision support system for clinicians to help them, again, with diagnosis, prediction, and treatment options for diseases. The initial work is being done looking at this very focused problem of stroke prediction in an emergency room setting. So again, stroke is a very, very common reason for deaths worldwide. Very simple introduction to stroke. I mean, there are two kinds of strokes. It essentially happens when the blood flow to part of the brain stops, and it could be due to an actual obstruction or bleeding, which results in that flow stopping. We have some numbers just for the US system that the estimated simply just the dollar cost of these strokes, and forget about the human aspects, is estimated to be over $70 billion in US alone. So back to the Indian setting, when you have patients coming into the emergency room, what we were told is that typically you do not have trained neurologists on call who are able to then advise the doctors currently attending to these patients on the severity of these cases. So we are again in relatively early stage in terms of collecting some of this data, going with some of the known risk factors. Part of this study, we are also trying to study if there are some risk factors that are specific to the Indian population, and we are also applying some research in areas like transfer learning, which looks at how once you come up with certain decision making for one population, how can you transfer those learnings to a different population, let's say from the US population to the Indian population and so on. And this is kind of the long-term vision of what we are after. We are trying to build an open healthcare analytics system which starts with collecting all of this data. So on one hand, you have the patient data, which is becoming more and more available in electronic form. And in fact, it was very heartening to see some of the initiatives from the Indian government where we are trying to impose standards because that's a big problem right now in the US system. And on the other hand, you have a lot of medical data becoming available, medical literature in various forms, text, images, and so on, which you can now start to analyze using big data techniques. And what we are building is just like we are building this stroke prediction model and so on. In the process, we are also trying to understand how we can design the system to allow an external entity to plug in their models for specific diseases. Because healthcare being such a vast area, at least my belief is it's going to be very, very hard for a single organization to have the best models for every important disease, let's say be it lung cancer, breast cancer, and so on. So if we can provide a system which can, through these open APIs, it can allow other researchers to access the kind of data and perhaps even a toolkit of some machine learning algorithms and then plug in their models. The eventual hope is that over a period of time, as a community of partners, we start to build more and more powerful systems that can eventually bring about dramatic improvements in the quality of healthcare with reduced costs and go towards at least doing moving towards the vision that I think Vinod Khosla quite summarized, which he outlined, which was a very, very inspiring vision. So I'll thank you for your patience. Thanks.
Certified internist in medical informatics who leads business development activities for 3M Health Information Systems in the areas of healthcare data dictionaries, vocabularies, standard compliance, terminology mapping, and interoperability. Mr. Poon.
Thank you. Thanks. I had a microphone in my hand. I was singing karaoke, so this brings back good memories. This is actually my first time in India, so I really appreciate being up here and speaking to you. But to be honest, when I first found out I was coming to India, I was a little bit nervous because I don't actually travel that much internationally. So I was worried about things like if my cell phone would work, if my computer would work, if I'd be able to get directions because I don't speak any other language except English. But actually, when I first landed in Amsterdam, all the gate agents spoke English and the signs were in English. I actually found a place to plug into my computer. And in the store, I actually found a plug adapter that had various plugs for 150 different countries all over the world. So people from any of 150 countries around the world could go to any of the 150 countries around the world and use their laptop or electronic equipment. So, and the same thing happened when I landed in Mumbai and ultimately Hyderabad. So I thought to myself, traveling internationally is relatively easy these days because of the ease of information exchange and the standardization that occurs or that's happening in the travel industry. Unfortunately, that same level of information exchange, that same level of standardization does not exist yet in healthcare. And that's what we're trying to solve here. So my job at 3M in relation to data analytics is we focus more on the data side than the analytics side. And the mechanism by which we do data analytics is to integrate data from disparate silos, to structure that data and to standardize that data. So the way that we do that not only accomplishes those goals for data analytics, but it also addresses a variety of other issues for a variety of other data governance issues for our customers. So things like interoperability between disparate systems, information exchange, reporting on clinical data for public health measures or quality metrics, obviously clinical research on your data, data warehousing, clinical decision support, and also compliance with data standards, data standardization, in other words. So we do all these things with an application that we call the Healthcare Data Dictionary, and the associated services that we also supply in addition to the product, the terminology consulting services, the mapping services. Those are the things that I'm involved in at 3M. And so our approach is the approach on the right here, and that is to have a centralized method to manage terminology and to maintain those terminologies and to do the mapping. So the scenario that I'm showing on the right is our approach, our philosophy, and one of the ways that we describe the Healthcare Data Dictionary, or the HDD, is we call it an interlingua. So this is analogous to English. If you speak a different language, you can speak that different language in your own country or amongst your family, but if you want to communicate with people from different countries, you can do one of two things. You can learn every language that exists in every country around the world, or everyone in the world can learn one other language, like English, some type of interlingua, and if that happens, every country or every person in the world can communicate with every other person through this interlingua. So the HDD acts as an interlingua. It's analogous to that plug I found in the store that can interoperate with various plugs around the world, so that whatever electronic device you're using can be charged in any country that you're in. And so this is the approach that we take. We want to be able to map every data source to a centralized method to manage terminologies and manage standards. And we want to do that once for each data source. We don't want to have to map every data source to every other data source. And that's important not only for initial mapping, because initial mapping is not the only problem. There's also the problem of maintenance. So you have changes coming from your data sources constantly, and you also have changes coming from the standards. So standards like LOINC, SNOMED, ICD, those have several updates every year. The customers themselves have updates to their codes and to their displays and to their mappings. Every time a change occurs, you don't want to have to make multiple changes. You want to just make one change and have it leveraged across every system that's linked to your centralized source of terminology management. So that's our philosophy. The end result of this mapping that we do is that we can allow our customers or our systems that are mapped to the HDD to continue to use their local codes, their local languages, but when they want to exchange information with external systems, they can do that because those external systems are mapped to the HDD as well. But even if external systems are not mapped to the HDD, as long as they can accept standard codes, because we have standards within the HDD also that are mapped into that database and to which we map our customers' codes, those customers or those systems can communicate via standard codes to external systems that can accept those standard codes. So this approach of using a centralized terminology server is our way of helping our customers achieve semantic interoperability, data standardization, and a method to maintain standards and manage those terminologies. Now, in a practical situation, this is how we've traditionally implemented the HDD. It's been in support of a EMR, clinical data repository. You see that we have disparate data sources sending data through an interface engine, which then routes it through an enterprise master person index for unique patient identification. But then it goes through the HDD for data structure, data standardization, before being stored in a structured and standardized way in a clinical data repository, where it can then be viewed by an end user through a presentation layer or graphical user interface. Now, the HDD mapping to the HDD and normalizing data from disparate data sources is, of course, the foundation for data analytics. The first step in big data is integrating data from disparate silos, standardizing and structuring it. And the same method of mapping that we employ can be used to achieve that. So here I'm showing an actual use case where we took a customer's data from disparate EMRs that they were using, and we mapped their laboratory and medications data to the 3M HDD. We used the identifiers within the 3M HDD, again, as an interlingua or a universal translator, and we used the codes within that interlingua stored in the data warehouse so that when a data analyst did queries in the data warehouse, they weren't using the original identifiers from the disparate data sources. They were using the identifiers to which we mapped those original identifiers as a normalization mechanism. So they're actually using our identifiers to run those queries. And because there's a hierarchy that exists in the HDD, they can build their queries and not have to create a different query for each member of a class. They can just query the class itself. Now, meaningful use was mentioned earlier. That's the kind of the requirements that are required of practitioners in the US to comply with data standards. And people are going to need a way to manage multiple terminologies and be compliant with those standards. And HDD offers a way to do that in a robust and efficient format. As meaningful use progresses, there's just going to be more and more standards that people are going to have to manage. So this is a very easy way to do that. Now, I want to call your attention to an open source or publicly available version of HDD that we've made available last year. If you go to hddaccess.com, you can access the software that I've been describing. We also have APIs there that you can download. It's all for free, no obligation. It's a way for people to evaluate the software and see if it could be useful in their organization. And I encourage you to visit that website. It has a lot more details than I provided you here today. And finally, if you have any questions, feel free to email me or reach out to me. Also, if you'd like a demonstration of the HDD, you can stop by our booth. It's booth 29 in the expo area. So again, thank you for your time.
That's the end of this discussion, but we're going to be continuing with a few other people joining us on stage who I'd like to invite Madhu Arvind, Vishwajit Lokaria, and Rajendra Sadhu to join us on the stage. They're going to be sharing with us some examples and on innovations that they've engaged in with technology and healthcare. And we're going to get to questions and answers subsequent to these discussions.
Mr. Madhu Arvind is a CEO of Health Superhighway, which aims to make the access to healthcare services seamless and transparent for customers. Madhu started his career in triology software, some of their key sales force automation solutions. So here we have Mr. Madhu Arvind.
I'm trying to limit my talk to just 10 minutes and also just talk about some specific experiences of what we've been doing so far. So I'm not going to talk about what we do specifically, but talk about some learnings that we've had in the past 2-3 years so that there's some use that essentially that you guys can have from it. So to begin with, so around 3 years ago when I came back to India, I mentioned to some of my friends and colleagues that I'm going to work in healthcare. So one of my colleagues who is a faculty member at one of the Ivy Leagues, he sent me this slide which said, hey, do you know that this is the space that you're going to work at? So initially my first reaction is, hey, it happens to others, not to me. I'm way too better. So when the bravado kind of dies down, you kind of think, hey, what is that he's really trying to tell me? What is the learning that I can have from it? So, over the course of the last 2-3 years, I think I have seen a couple of things where why some of these things happen. And specifically, if you look at it, if you take startups in healthcare, especially in the US and more so in India, the failure rate of healthcare startups is 5 to 10 times than in other spaces. And the big companies don't fare that much better either, how much of a big you are. So what I'm going to be covering over the next few minutes is some of the things that we can kind of learn, at least as a small company, to kind of circumvent some of the problems that is typically faced by these kind of healthcare companies. So the first thing is most of healthcare technology specifically is trying to focus on some behavioral change of the end consumer. Let's ignore the enterprise software for a second. Let's focus on what kind of things that essentially is going to be the end user or the patient. So if you have someone who's unfit, let's say like me, who is 100 kg, they're trying to get me to do activities. If you're a chronic patient, let's say you're diabetic, then they're trying to get you to be in touch with your physician more often, compliant with your medications, and so on and so forth. And if you carefully analyze where many of these companies fail, is the human behavior that essentially the end user or the patient is never doing the activity that he's supposed to do in the first place. The minute that happens, nothing else obviously works. So a lot of work has been done over many decades, and this is something that I'm borrowing from some work done at Stanford University, is you got to understand human behavior to figure out how to kind of make them do things. So it's not about healthcare in general, but it's applicable for any other field. But let's talk about healthcare here. So broadly, there are two things, right? You got to have the right level of motivation. You got to have the right level of ability. The combination of which is kind of going to make you do certain things. For example, if you're someone who's highly motivated, you're willing to climb Everest, you're willing to do whatever it takes, irrespective of your ability. On the other hand, essentially, if you are least motivated, you're not going to do anything in life anyway. The reality is that most of us are modestly motivated. Like, there are highly motivated and lowly motivated, but most people fall in the middle bucket. A lot of technology that is out there is trying to get people to be more motivated, right? They're trying to say, okay, with content, with information, with intervention, they're trying to figure out how to motivate people. But it sounds like an oxymoron to me, because unless they can induce an epiphany, which probably happens once or twice in a person's lifetime, motivation levels do not really change. So we got to look at what else can change the behavior of a person. So let's look at another aspect, ability. So in reality, if something's very easy for us to do, we do it. If something's complicated, we kind of say, hey, I don't want to waste my time on it. You go to a website, you don't understand what it's you don't understand what to do, you're clicking around, you don't know, you said, okay, forget it, let me go and do something else. On the other hand, if you make something extremely simple, let's say in Amazon, a one-click purchase, it's making something extremely simple for you, so you say, okay, let me actually try to do it. So one of the things as product companies that we could think is, how do you kind of target the ability aspect? That is, make things extremely simple so that you can make the ability threshold to be much higher. That is, you're much, much more able, which means the simplicity is also way higher. And I'm going to talk about 2-3 very simple examples, which are very, very dumb examples, but in reality, dumb things done well is kind of what works. So I'm just going to talk about some things that we did in these lines in essentially healthcare in India. First is online medical records. People have talked about it to death. In the US at least, it's been going on for decades. But reality is that practically the usage for any of this technology is not there. So 2-3% adoption, and the total number of people who have access to it itself is way too small. So you got to think like, okay, why it's not happening? Fundamentally, why it doesn't happen is, many of these technologies, essentially, you got to enter your own information. Yeah, as if I'm going to do it. I'm so motivated that I'm going to go and take my medical record, start entering information into some portal, and expect some magic to come out of it. It just doesn't happen that way. The other thing is, there are some of these connected portals, which are essentially connected to certain providers and so on and so forth. What essentially happened was, because of all these standard issues and so on and so forth, it became very expensive to do. People don't want to pay for it, and the number of adoptions that is on that model also fairly less. So what we did is, let's try to tackle those two problems. One is, you don't want to kind of have the patient enter any information. If you went to a provider, it has to show up. Secondly, how do you make technology in a way that the cost of doing that integration is fairly small? So I don't want to get into the details, but what we did is, just a number that I put out there is, we built a platform which enables you to kind of integrate to any kind of EMR, even if it doesn't conform to the standard norms. And in India, EMR landscape, of course, is way more diverse than anywhere else. And just to give an example of that, we've kind of integrated more than 50 EMRs in just a matter of 4 to 6 months. So what does it mean, right? Once you do that, so let's say you go to a facility that we work with, you go and see a doctor, he prescribes some labs, diagnostics, and what happens is, instead of the normal experience where you go there, they tell you come and collect your reports at 3 o'clock or come at 5 o'clock, whatever, you now know when you're going to get your information. As soon as the information becomes available in your EMR, it gets published to your PHR and you get a notification that you can consume it. And you can consume it via your PC or your mobile. And when I say mobile, I'm not saying, hey, I'm having an Android app and so on and so forth. You can pretty much access it in a clean way from any HTML-enabled phone. And over the course of the last 1.5 years, what we've seen is we work with around 2.5 million users, which is probably one of the largest worldwide, except for Kaiser Permanente. And the adoption levels that we have is 20+%, which is at least 10 times what is there in the West. And the idea was fairly simple. How do you figure out a way in which you reduce the or increase the simplicity, increase the ability so that someone who wants to use such a solution can use so. And I mentioned about diagnostics, but it's true for every kind of document that is there, discharge summaries, health check report, and so on and so forth. Yesterday I heard like people mentioning about India being diabetic capital of the world, cardiac disease capital of the world, and so on and so forth. So naturally there are a lot of technologies out there which is trying to address this problem. And many of them are like devices, which I think some of the my acquaintances will be talking about. Devices have been around for a long time, but fundamentally, so I bought a device for my mother last year, and it's supposed to be this cool Bluetooth-enabled device which is used to test sugar levels. And okay, I gave it to her, and there was an app, and I tried to make it work, and I was like, okay. After 10 minutes of trying, I said, hey, forget it. You do whatever you do normally. And what does she do normally? She kind of tests the sugar levels, and she has an idea about it. When she goes to a doctor, she tells them about it, and then there's a conversation, and they kind of manage it. So the clunkiness of that kind of technology is way too high, or you have to go through some portal, enter data, which also doesn't happen. So what we have done is something slightly different. How do you kind of give the same experiences you working with your doctor, but you do it at home and multiple times? So working with multiple partners like Qualcomm and so on and so forth, we've done two things. One is, first of all, the minute the device is there, you take the reading, you don't do anything, the data shows up in your PHR automatically, number one. To get the same experience as what you do at a doctor's office, that data is then triaged by a call center, which is going to be escalated to a doctor if needed, and the same kind of advice that you have got by going to the doctor, you can actually get through this model. And what we kind of experimented with is we checked the compliance level without this model and with the model. Without the model, to be honest, out of 100 people we tried, not even one person actually did it on a continuous basis. With this model, more than 50% of people were actually following the routine, which means they were taking the readings and getting the advice from the doctor. So something very basic, but with good result. The last thing I want to talk about is an experiment that we did in healthcare product retail. When you look at product retail, there are two kind of things. One is doctor prescribes you medications, and then there are other health-related products that essentially you would be having to purchase. The compliance level on taking medications, as you all know, is not really the best. There are various tools that are there for it. There are online tools you can go and register your medications. They'll give you advice, content, so on and so forth. It doesn't work because, again, the ability for you to do it is, essentially the motivation levels have to be much higher. What we kind of do is something very basic. We take your medical data, that is your medication data. We kind of automatically pull it. We give you the right kind of information for you about price points, comparisons, ability to purchase in one click, and so on and so forth. And on top of that, we take a lot of structured and unstructured data that is there and segment your information to say, hey, you are a diabetic, you're an orthopedic, you have an orthopedic condition with this kind of age range and so on and so forth, and give you the ability to purchase various products in a very, very easy fashion. Not getting into details, but essentially typical campaigns that you have 1 to 2% conversion. What we kind of have from our experiments is, which we ran over 6 to 9 months, is around 25%. So the same idea applied to various use cases, you get the similar kind of result. So many, many such things are there. Don't want to cover any of these things today, but in appointments, in how do you connect with physicians, in analytics, we have done all of that stuff. Happy to talk to anyone offline about it, but I just want to convey just one point that in product design, if you try to focus on how do you really increase the ability of a patient and enable them with technology, you'll see a result that you typically don't expect. Thanks.
Well, the next presentation, Qualcomm Life Engineering Team in India.
Thought I would have to prepare a presentation. I mean, my focus is mostly on demoing the solution that we have. And initially, I thought maybe I will have to build the context before I demo it. But hearing all the speakers before me, they've already done a very good job of building the context. So what we are all about, so I will just zip through my presentation and get down to action. What are we about? We are actually transforming healthcare. So our mission is to mobilize healthcare, and we see a world where healthcare is accessible anytime, anywhere, as most of us are trying to get to. Now, why mobile technology? Again, I don't have to spend too much time on it. The first speaker has given all the statistics of mobile usage in India. But just some of the interesting statistics is that more people have access to mobile technology than they have access to pure water, electricity, or even toothbrushes. So it makes it definitely very important that we bring healthcare to mobilize the healthcare. So everything is becoming mobile. You used to read books. Now it is on your smartphone or iPad or other tablets. Your music is there. Your photographs are there. So why not healthcare? Why not your doctor? I mean, of course, you can't replace your doctor, but at least you can take control of some of the parameters of your own health. So everything is going mobile, so healthcare will go with it. Another interesting statistics is that smartphones, connected devices, will overtake PCs as connected devices. That's where we come in. That's where Qualcomm Life comes into play. So what we have built is a solution that allows you to connect devices, biosensors, medical devices, seamlessly via a number of gateways, specifically 4 gateways. And I'm going to demonstrate one of the gateways, which we call as a 2-net hub. And it seamlessly gets the data from these devices and transmits it over cellular technology to our backend infrastructure. And from there on, it can go to wherever you like to Healthy Way or any other hospital, warehouse databases, or your insurance company, or to your family members who can actually monitor your health. So specifically, we are focused on building an ecosystem. So we act as enablers. And what we have built is what we see building us is like 4 gateways, 2 of which are already launched, one just like 2 days ago. The first one is being the 2-net hub, and one of it is already plugged in here, which we'll be demoing shortly, but I will also display. So this is what is a 2-net hub. It's like a adapter form factor. This is what a patient gets as a part of his kit with devices that the doctor prescribed, be it your blood pressure monitor or your mom's glucometer or a thermometer for your kid or whatever that is. And you simply take this and plug it into your wall socket, and you take your glucometer or your blood pressure monitor, take your measurement, and that's it. The measurement should automatically transmit through this gateway back to the infrastructure in the cloud and should get directed to your doctor right away. And from there on, there are multiple use cases that can be supported with this, which is like, for example, the healthy way as described, like you can have alert monitoring system. I mean, simple things like whether mom checked her blood glucose this morning or not. If she did not, then you can just, either you can call her or you can pay for the service where that service actually monitors based on alert, and then they will call your mom to say, hey, ma'am, you didn't take your blood glucose this morning, so please do that. The next gateway, basically this piece of hardware has capability to interact with devices that or short-range radios like Bluetooth, Bluetooth LE, Wi-Fi, or even legacy devices with USB connections. On the other hand, it has also a 3G or a WAN module, a wireless access module, that allows it to transmit the data over wireless seamlessly using cellular technology. The next gateway that we just announced and has been launched in the US is the gateway on the smartphone. We call it TuneIt Mobile, which does the same thing on the smartphone. The third one, which is on the roadmap and will happen in the future, which is the ultimate goal, is to actually get the functionality directly on the device itself. So you just simply take the measurement and it seamlessly goes to the cloud infrastructure. And on the fourth front, there are other ways in which you can get data, like from your PHR systems or even some of the devices that are not integrated in the ecosystem, but are sending the data through their backend infrastructure. So there can be a backend to backend infrastructure integration as well. And so all of that data can gets into one place, and we do that securely. And we also provide APIs in the back end, which can allow you to get the data and design or write applications, some interesting applications on top of it. I think somebody was asking question this morning, how can they do that? So this is one of the ways in which you could actually build some interesting apps for smartphones. With that, I will get into action. I have a number of volunteers here, so just be aware I'm going to take blood from you, make a cut on you, and let's see what happens. Just kidding, okay. So what I have is basically simple devices. I have one thermometer here. I have an oximeter here. I have a BP monitor here. So I'm going to give these devices to the folks here and ask them to take measurements. These devices have been associated with this particular TuneIt hub. So when they take a reading on this, it will get captured by that device. It will show you the reading over here on the display, but then it will automatically go to that hub from where it gets transmitted over cellular technology to our backend infrastructure. And I believe they will have the website up here, which will refresh itself and show the reading. So, sir, I would request you to take a temperature measurement, and the way you do it is, basically this is an ear thermometer, but we'll just use it on your hand so that you don't have to change, for hygiene reasons, change the caps on this. So we'll turn this on, and then just press it against your palm. You don't have, that is just turning it on. Give me 1 second. Let's turn this on, and then there is a button on the back. So what you do is you press against your palm and then press that button. Actually, you can do it the other way around so you can see what the measurement is. So it will get into a mode. So now it's measuring that. I think it is 93.2. And Actually, you can leave that. You just press it once. Could you focus on the hub, please, here, down, so people can see the LEDs that glow? So there are visual indicators. So exactly like how Madhu mentioned about mom not being able to deal with all the Bluetooth stuff. Yeah, so it's sending that now. So you can see it is blinking. So that indicates that the data is being captured from this device onto the hub. Now on the left-hand side, what it will show when it is actually sending it out to the cloud infrastructure, which should happen in a few seconds. That's happening there now, where it is actually sending the data to our cloud infrastructure. And hopefully, if you can have the browser up. Okay, it's on that screen there. Okay, there we get the reading, which is, on the right-hand side, you get 92.5. Does that sound right? Okay. So that's how this technology works. It is seamless, allows anybody without having any technology expertise to use it, and this is the way to do it. Maybe we can try one more. You want to measure your blood pressure monitor?
Maybe in the interest of time, we'll
okay,
stop
that's
at
fine.
one.
Sure, no
we'll
problem.
believe it repeats. So.
Sure, no problem. If
you.
anyone has any other questions or anything, I will be happy to discuss with you offline later. Thank you.
Thank you very much.
Thank you very much. We introduce our next speaker. Programming languages, marketing, wireless protocols and applications, product innovation and global business strategy. Rajendra.
I know everybody is hungry and wants to leave as soon as possible. I'll cut short my presentation due to the time. Okay. I hope everybody believes in the statement, necessity is the mother of innovation, right? Believes to be true, in my case, multiple of times. A couple of years back, when I came back to India, after looking at certain scenarios, I felt in need of an emergency response system where on press of a button, it connects to the emergency. We see accidents happening frequently on the road, and no one knows who that person is. No one knows who are the relatives, how to communicate to them in case of an emergency. And if their sons and daughters, if they're living in United States or somewhere abroad, they are very worried about whether their parents are taking care of their vitals or they're checking their health data frequently. In case of an emergency, how will I know automatically? Taking all this into consideration, I came up with a device. It's a smartwatch, which was developed in Hyderabad in 2010. It uses SIM card. It has multiple features. It has a couple of emergency buttons, inbuilt GPS, medicine reminder, fall detection, and it interacts with a lot of medical gadgets, like the way he showed, a pulse oximeter, EKG, blood pressure monitor, body scale, or a chest belt. So when someone checks their data at home, it automatically transfers through the smartwatch to our server. We can set up thresholds, preferences. So in case if the blood pressure is not between 120 to 70, then you raise an alarm to either the kids or a hospital or some ambulance emergency service, which can be configured. With the smartwatch, you are not confined to a location. You can go anywhere. I mean, you are traveling abroad, and you can still change the SIM card and get the vitals. So someone who is far away can still get the readings. And afterwards, we added a lot of features, things like fetal Doppler. Since that we have a hub, we can add multiple devices to it. In India, maternity and child health is one of the key concerns. So we came up with a wireless fetal Doppler that connects to the watch, sends the fetal heart rate. So a pregnant woman can stay at home, check the fetal heart rate, transfer it wireless, and she can get all the messages onto the watch, the diet tips, fitness tips, some Lamaze videos, or even vaccination reminders. So from age 0 to 18, what are the vaccinations that the kid has to take, all that information. Then we realized there is a need for early intervention, where there are a lot of kids that they have problems because few things like a hearing problem or a vision problem or a dental problem which were not diagnosed at an early stage. So we came up with a kids program where a kid can be checked in the school, like a school nurse program, and all the data can be transferred to the hospital. And the same data can be monitored by hospital, by the parents. So if someone is working nowadays, if both wife and husband doesn't work, it's very difficult, right? So, and if they have to stay back home to take care of their elderly parents or kids, it's going to be difficult. So what we came up with a school nurse program where the school can transfer the same data to the same portal, and the hospital is looking at the same portal, and the working wife and husband, they can monitor the data onto a mobile phone. So that connects the entire ecosystem. And regarding how many people would like to use the mHealth services, so we found that a lot of people, like, they want to prescribe, and then if they're not using it, so how do you motivate them? So we came up with programs like rewards programs, where if someone is using the watch to walk for 2 miles, based on the GPS, I know how much distance they walked. So we will reward with 2 points, something like Visa rewards points, right? People don't want to use their cash, they want to use their Visa card, and then accumulate some points at the end of the month so that they can get some gift. We came up with the same concept, so if someone checks their blood pressure, they'll get 2 points. End of the month, all these points can be exchanged towards some discounts in the pharmacy. People love discounts, right? That's the first thing we ask, is there any discount? The same data can be exchanged with the insurance company. In US, for example, my auto insurance is giving a discount if I have a LoJack or auto theft protection system. My State Farm insurance company gives a discount on my home insurance if I have a ADT at my home. And we are giving the information that the customer is checking their health every day, and he's staying healthy. So should the customer get a discount on his life insurance or the medical insurance because he's doing a preventive health care. So we introduced a rewards program with the insurance companies too. Then came up, can we give discounts, coupons onto their watch so that they can exchange into the nearby store? So based on the location on the watch, we know what are the nearby stores and what are the items that they're having. Is that useful to this customer because he's a cardiac patient? So I have a blood pressure monitor which is much cheaper, so I can offer it to him at a discount price. So he get messages saying that it's available in so-and-so store for cheaper price. So he can exchange for the discount. So it's the entire ecosystem that we built. We motivate the customer. The place, it doesn't matter where exactly we need to deliver. So the healthcare delivery, the 5 P's of marketing, the product, services, place, price, promotion, and people. So we brought in all this marketing into the healthcare delivery, which makes it more attractive and more adaptable to the customers. Thank you.
Thank you very much. So we have a few minutes for questions and answers before what I understand is a very exciting lunch. So.
Analytics and big data group. I don't think we have dearth of data or even context-sensitive data. How is it being effectively used for epidemics in the World Health Organization or at our country level? That is question A. And question B is, there is a superbug phenomena I have been hearing about in the US hospitals where the drug mutant bugs are coming out. How is data analytics helping there?
One of you want to go?
About epidemics, I won't give you a comprehensive answer, but some interesting things which are happening is with the prevalence of social media, you're beginning to see things like Twitter feeds being used to even detect these incidences of epidemics traveling. So things like Twitter feeds as well as even Google queries. So there has been work done in terms of even analyzing the kind of queries that are being submitted to Google. And as you start to see greater incidence of queries related to a particular disease and so on, you often that gives indicators of the spread of some of these epidemics. And more recently, there was this, in a different context, there was this interesting thing that happened about an earthquake, where they actually said the information about the earthquake actually spread faster through the Twitter feed than the actual speed of the earthquake, just because kind of information can travel at the speed of light as soon as kind of it's been posted. So that's been one interesting direction in how big data is being used at analyzing. Of course, there are other models being developed. So for instance, when this whole avian flu and so on broke out, there were detailed models that got built about which were even doing then predictions, because you could then apply simulations and try to play all of these what-if scenarios in terms of as you control the movement of population from one area to another and so on, how would those affect the actual rate of spreading of some of these pandemics. So there have been also work done on building these detailed simulation models about the spread of epidemics.
Someone, if they can afford the watch, and for the NRIs, they can do that. For rural, the same watch can be shared across 99,999 people. So it has a facility to change the sub-ID, which so that you can actually check the healthcare of 99,999 people. Now, this is available through ATHS, Apollo Telehealth. It will be installed across all the telehealth locations in Apollo. And a patient, after he is discharged, they can carry the kit, one kit, and take it home and send all the medical data so that hospital can monitor them after for a month or so that we can reduce the readmissions. And the other one is the school nurse program, which is basically can be established in each and every school. And the last one is the personal emergency response. So this can be used by women, people who are working in BPOs, call centers, who go to home late in the nights. In case if they want a security, this watch has a button, multiple buttons. One button can be configured for 3 numbers so that it can call police or the ambulance service. It's used by security. We get a lot of calls in India. It's unbelievable. The number of calls that we receive for kid safety is much more than any other country. And when we ask, what's the age of that child? They say 3 years. 3 to 6 years is what they're more concerned about. Kids go to school in Mumbai, like 4 kilometers, 5 kilometers, and they're worried till the time they reach home. We get calls from people who are worried about their parents, elderly parents, and diabetic, cardiac. And the same system is now available through ATHS, and Apollo Pharmacy, everything is involved. So you see it's a huge leap forward in terms of the personal emergency and the remote monitoring when compared to what it was a year before. I'm not sure exactly. You can definitely, you can find it at the ATHS booth.
Yes.
In fact, 6 months back, my friend, he passed away in Connecticut. He works for Hartford Insurance. He was working in the basement, 5 a.m., checking his system. The phone is right nearby, but he got a massive heart attack. He's 38 years old, 2 kids. He couldn't reach the phone, and he passed out. We want something that's glued to the body. I know these mobile phones are there, but whenever there's something, an emergency, the phone is somewhere away.
No, this is entirely a separate application, say a child reaches the home safely or not. It has nothing to do with the healthcare. As far as healthcare is concerned, there are jackets, health jackets are available, where everything is available. But specifically designing a watch and putting the devices, because devices you will put that has a range. You cannot put a device for kilometers where you will get the parameters from.
Right. I understand your concern. I wear my shirt and wear the watch, and even I walk in on the street, it can give me skin temperature, heart rate, and EKG.
But you have to take the sensors along.
No, I can wear the belt inside my shirt.
That's what I'm telling.
And the watch.
This is not a uniform application. Means it's not a, it's an application for old people or something. It is welcome, it is good, but it is in a jacket. You cannot put the devices along. Or if you want to put at home all these devices, it's fine. If mobile is there, we don't need the watch to be put. That's what my...
right. I understand, but...
Can we keep the question brief, just sharp question, running out of time?
Fine.
Sorry.
Put in your thermometer or how you have tested it.
Okay, so one thing I would like to clarify is that I work with manufacturers who already have expertise in building those. What we do as Qualcomm Life is integrate those devices into our ecosystem over standard protocols, over short-range radios like Bluetooth. We take the data from the thermometer and transmit it over short-range radio Bluetooth.
That's fine, but no device, medical device, you can sell without standard. Certain standards.
Okay, in the interest of time, what we're going to do is we'll move this conversation further. I see there are couple questions here.